Hello, I'm Alice from Cape and Apron, and I'm here to talk to you today about overcoming birth anxiety and how that can be a huge stressor for most women who are going into labor and delivery. I have a few suggestions for you because when I was pregnant, I also had a big fear of going into labor and delivery, enough so that I wasn't sure I was able or was I was going to be able to have kids. It was so overwhelming to me, but I really, really, really wanted children. I always wanted to be a mommy and have a family, even at a young age. So I have some tips for you that helped me and that I feel strongly will help you. The first thing is, just kind of one of those things like avoid scary stories while you're pregnant, for sure. And I know for some reason it's like your coworker that has never had a child just wants you to know the craziest birth story that she's ever heard. And some stranger in the elevator is gonna be like, "Oh, you're pregnant? My aunt's sister's best friend," and I don't know why people feel like they're pulled to say those kind of things. It's annoying, but try to avoid. Maybe ask them not to nicely, or just be like, shh. So, because that doesn't help, and most of the time they're not realistic and they're exaggerated, and media does a terrible job at having truthful labor and delivery stories. It's not right. It's not true. So that's the second thing. Educate yourself on the birthing process. So confront your fears head on. Walk through the entire process with information that isn't fear or myth based, but actual fact. So, before I had taken a labor and delivery class, I had all these preconceived notions on what labor and delivery was like. And that came from media. So, like television and TV and those crazy birth stories. And I went into that prenatal class, or childbirth class, and watched women have births, all kinds of births, with pain management or not, with epidurals, every single option that was available. And it was as opposite as could be, and it made me feel a lot better. And there were pain management options, there were natural options, there's all kinds of things that you can do. So just kind of facing those fears head on and taking a prenatal course is what I would most suggest to you. So my favorite one is Hillary Erickson's. She's been a labor and delivery nurse for over 16 years, and she's awesome and down to earth and very educated. She's delivered hundreds of babies, taught this prenatal class for forever at her hospital and then in this class, and I'll drop the link for you. I highly recommend her stuff. She also has a free version, which is really great. And I have a coupon, which is awesome, for just Cape and Apron's readers. Okay, so then pain management is another thing. Thinking like, oh, what if I can't handle the pain? It's going to be too excruciating. So there are plenty of options about that, and once you get educated, you can have a pain plan, learn about pattern breathing, because there's scientific evidence that shows that if you take the concentration to your breathing rather than to or your brain's concentration to your breathing rather than to the pain, then you'll lessen that by far. So there's some other fears that you might have. Fear of an epidural, fear of a C-section, fear of not getting to the hospital in time, fear of a bowel movement during labor and delivery. Don't worry about it, nobody cares. Fear of embarrassment. These are all normal. I feel like every single woman on the earth has these fears before they go into labor and delivery for the first time. And you're not alone. And women have been having babies for all eternity. And the nurses and the doctor that you are going to have your child with, this is their area of expertise. And they have probably seen hundreds, if not thousands, of babies being birthed. So you're not alone, and this is not anybody's first time. So there's a huge level of comfort in that. Even though it's your first time, um, everybody else in the room has got this. Um, and then one thing you can do is make sure your doctor knows about any birth anxiety you have. So you could jot down 5 or 6 points of concern that you have and discuss them with them. So don't be shy. Let your doctor know. Talk to them about it. And have a support team. So, studies have shown that women with a labor support team have decreased their need for painkillers and have had more successful non-traumatic births, which is astounding. So, just having a good support team, somebody there in the hospital with you by your side, and not having people there that would stress you out. So just don't be a yes person to everything. In labor and delivery, this is the time that have to say, be selfish and have to kind of put your foot down, even though if that's not your personality. Just really kind of try to think about what won't stress you out and where to draw the line and direct people, because you're the one going into labor. So you are like the person in the center of all of this. So, don't be afraid to tell your aunt or cousin or whatever that comes bursting into the room all excited while you're in labor and is like unloading her suitcase from she just got off the plane and trying to talk to you about all the stuff. And just, if anything's overwhelming, just politely excuse people out of the room, and make a plan for how you want your birth to go and who needs to be in the room during labor. And then there's active labor at the very end when you're pushing. So maybe you don't mind some people coming and visiting beforehand. If you have a longer labor, mine was like 26 hours. So the first part I was, just resting in bed and had an epidural. So that's totally fine. You can do that. And then once your nurse or at the end of that labor, oh, it's time to push. And that time frame can be anywhere from like 45 minutes to like 3 hours. First time moms, it's usually like about two-ish. But your doctor will know more. Those statistics could have changed since I had my first. That was 3 years ago. So the most important thing is just to know that you're not alone. Most first-time moms and experienced moms get a major, major case of the jitters when it comes to labor and delivery, and it's totally normal. And you'll be okay. You've got this.